If you or your loved one is impacted by diabetes and have questions, the Barbados Diabetes Foundation has the answers.
It's always easier to reverse diabetes, certainly control it properly and avoid complications if you at least know that you have it.
So it's just again to re-emphasize the importance of good diabetic care. And diabetic care involves really almost every part of the body. So it's your feet, your heart. But again, we're coming back to what our main focus is at this time is the eye care.
The Maria Holder Diabetes Center, located in Warren, St. Michael, is your source of diabetic care. You can reach them by calling 243-EYES, 243-3937 for more information.
A happy Saturday morning to everyone tuned in to VOB 92.9 FM. I mean, you know, relaxing at home listening to VOB, or you might be driving in your car. It's now past 9 o'clock, which means your favorite health show is about to start. It's time for 15 of the healthiest 10th anniversary minutes you will hear on your radio. All with the compliments of the Barbados Diabetic Eye Screening Program, the Maria Holder Diabetes Center, and the Barbados Community Foundation. This is Peter Boyce here. How is everybody this morning? Everybody good? But if you're not good, you'll be good by the time this show is finished, because if you are diabetic or pre-diabetic or don't want to be diabetic, this show is for you. Telling you all about the Maria Holder Diabetes Center, which is located in Warren, St. Michael, behind Eunice Gibson Polyclinic, your one-stop diabetic shop where you can get everything that you need. You can get your ice cream for diabetic retinopathy. You can get a podiatrist to look at your feet. You will find a dietitian like Victoria Cox to teach you how to eat healthy, so that put in a sauce that you planning to eat today, should you be eating it, Victoria Cox would guide you on the right healthy path. All of this at the Maria Holder Diabetes Center, where you'll also find diabetes specialists, nurses, and doctors. And speaking of doctors, in today's show, you'll be hearing from many diabetic health professionals, including Dr. Diane Brathwaite and many more. So without any further ado, because I know the gossip people at home saying,
I don't want to hear you, Peter Boyce. I want to hear Dr. Diane Brathwaite.
So let's say good morning to Dr. Diane Brathwaite.
Good morning, and this is Dr. Diane Brathwaite from the Maria Holder Diabetes Center for the Caribbean. We want to say happy Saturday. We hope you had a great week, and we hope that you enjoyed the bank holidays and were able to get some of the rest which you may have needed, or time spent with family and friends. This Saturday, we have a little mix of topics we'll be kind of breaching, and an interesting patient story. First of all, I wanted to talk a little bit just about high blood pressure. It is known that hypertension is actually quite common in our population, and we say that about 40% of our adult population actually lives with high blood pressure or hypertension, and that represents what we call the pressure of the blood in the arteries. Now, arteries take blood all around our body, pass blood through all of our organs. They go into smaller vessels called arterioles and capillaries and take blood to even finer parts of the body like the skin and other parts further away. So this means that hypertension, if not controlled like diabetes, can actually affect multiple organs in the body because it's experienced by multiple parts of the body. Now, data actually suggests that high blood pressure is much more common in persons living with diabetes, as is high cholesterol. This is actually not surprising because we do know that insulin resistance contributes to all three conditions: diabetes, hypertension, and cholesterol issues. Some research shows that hypertension might be as much as twice as common in persons living with diabetes. When we have done audits in the past in our clients who are referred from the polyclinics, we have found that the rates of hypertension are about 65 to about 70% of the adult population that we see among those referred to us. So this is nearly in keeping with what some of the literature is saying. However you want to look at it, they're pretty high rates. We do know that high blood pressure, uncontrolled, is a major cause of cardiovascular disease, things like heart attacks, heart failure, conditions that affect the brain, such as strokes, whether it be what we call an ischemic stroke or a hemorrhagic stroke. It can contribute to that if not controlled. It can also impact on the eyes, and it can also impact on the kidneys as well. And high blood pressure, along with diabetes, are our major causes of kidney injury and also kidney failure and end-stage kidney disease in Barbados. We do also know that if you have diabetes and your blood pressure is not controlled, you are actually more likely to have kidney injury. And if you do get kidney injury because of the diabetes, poorly controlled blood pressure will actually accelerate the rate at which your kidney function declines. So what numbers should we be looking at basically for control? Like diabetes, the blood pressure numbers are to some extent individualized. However, we generally want the top number to be less than 130 millimeters of mercury, and the bottom number, that represents what we call the diastolic blood pressure, or the pressure when the heart is not squeezing blood around, less than 80 millimeters of mercury. However, I would strongly advise you to discuss with your healthcare provider what your blood pressure should be. There are only certain cases in which we recommend that the blood pressure maybe be kept a little bit higher than this. For example, if you have drops in your blood pressure which are significant when you're standing, that is called postural hypertension. They call it posture because the change in the posture causes the drop. In the healthy adults, drops in the blood pressure on standing are not common. So therefore, if there's an issue with the blood pressure falling when standing, or you're getting dizzy when you stand and you find the blood pressure is dropping, you definitely need to talk to somebody about it, especially if you have diabetes and you know this is happening. I'm sharing this case because I had a client that I saw this week, and he was only in his 30s, stopped taking all of his medication for a couple of months, and the blood pressures were so high, they were 230 over 150 or so. And I think it's very important that I want people in Barbados to remember, do not just stop blood pressure medication. Some people think, well, I can take, a herbal tablet and stop the blood pressure medication. But the reality is, for that many people, a tablet outside of traditional medical therapy may not control that blood pressure properly. And if you're not checking, you don't know. Hypertension is another one of those what we call silent killers, because it really doesn't cause any symptoms until it really causes you a massive problem. So don't go there. Please get advice if you're having a problem with the blood pressure medication. Please make sure that your blood pressures are controlled. If you're able to get a blood pressure machine, please purchase one. There are some what we call validated brands in Barbados, and the Omron is quite widely used. We prefer for people to use an arm cuff, and ask your doctor or a nurse or other healthcare provider as to how to take the blood pressure properly and safely.
Thank you, Dr. Diane Brathwaite, for all of those cautions about the connection between hypertension and diabetes. I hope you at home was listening properly too, Don't be on the phone or on the Facebook when Dr. Diane talking. What you hear on this show could save your life. Just like the next person you are going to hear, Nurse Tracy, telling you the correct way you should be injecting your insulin. Phones down and listen.
Good day, this is Tracy Bushell, Diabetes Specialist Nurse for the Maria Holder Diabetes Centre for the Caribbean. Just wanted to share with you some further information, and this is regarding administration of insulin. Insulin is designed to inject into the fatty tissue, and ideally around the abdomen area and the outer thigh. Obviously, when administering insulin, ensure that it's a clean environment and that you have clean hands when doing this. The way to inject would be at 90 degrees when you place it into the fatty tissue, and not at 45 degrees as some people may try. Injecting at 45 degrees means that the insulin will just go under the skin and may not be absorbed correctly, and you might therefore also see a tiny bubble that forms under the skin. It's very important to rotate your injection sites, because if you give insulin into the same areas over a long period of time, you can develop hard lumps and insulin will not be absorbed as it's designed to do, depending on whether it's a long-acting or a short-acting insulin. Once you've administered your insulin, before you pull the needle out, count to 10 quickly, and then that ensures that all the insulin that you've either drawn up in the syringe or dialed up on your pen is actually injected into you.
After all that injection talk, that leads us into our song of the day. This is the Honorable Dr. Anthony Gabby Carter with his classic Kaiso. Dr. Cassandra compliments the Maria Holder Diabetes Center.
Why she give me pain, now me whole body feeling better than ever. She gave me one injection in my midsection, I didn't have to pay. Then she gave me something and then me swallow fever van right away. One injection in my midsection, I didn't have to pay. Then she gave me something and then me swallow fever van right away. When you're coming back, Santa, when you're coming to give me a medicine. Medicine. Be quiet, boy, I'm your doctor. I'm here to make you better. I'm your doctor.
Remember, if you want to make an appointment to see a good doctor or nurse or dietitian or podiatrist, the Maria Holder Diabetes Center is where you should be calling. The number to call and make that appointment is, get Zana, write it down, 417-0305. But if you want to get your eyes screened for diabetic retinopathy, remember you must do that every year. The number is 243-3937. Good. You can look out as the Maria Holder Diabetes Center participates in the Rotary Club of Barbados Family Health Fair, which happens next week, Saturday, the 11th of May at Golden Square Freedom Park. That's the day before Mother's Day, remember? So you can take your mother to that and make sure she's good for the next day, as they're going to have some free health checks from the Maria Holder Diabetes Center and other health entities as well. In case you've been hearing all about the Diabetes Foundation all morning and you might still have some reservations, let's hear from this patient of the Maria Holder Diabetes Center on how the center saved her foot.
I didn't know nothing about ulcers at first, but when I do find out, I guess it come from where I was working, the safety shoes, and I didn't know I was supposed to wear safety shoes like that because I carry seated toes shoes. So there I finally had it, but I didn't know. So when it did get bad, I've been to the doctor. When I get to the doctor told me I have to go straight to the hospital. When I get to the hospital, they're admitting me. So they monitor me, and then they come and tell me I have to get the tooth off because the foot infected. I tell her okay. Then they claim now that the blood wasn't flowing to the foot. So eventually have to get the foot amputated from a little above the ankle. I told her no, I don't want it. A girlfriend of mine come and look for me. She tell me, after my discharge, she gonna release me and carry me to a herbalist. I been from there, but when I get discharged, she sent me to the clinic in St. John. They wasn't doing nothing, it's in the progress. So I was between the clinic and my herbalist. So then a girlfriend didn't see me at church. She told me about this clinic here, down here. She make an appointment for me, and I come to see Dr. Bradford, and it went from there. It's going a year now I was here, and it get real progress. Right now, I will admit anybody to come here. These people here is very nice. It works for me, it works for anybody. They saved my feet, and I'm proud of it. The honest truth. And I thank them very much for what I see, and I will continue till eventually I get better.
For over 10 years, the Maria Holder Diabetes Center has been effectively serving the diabetic and pre-diabetic community of Barbados with a range of international standard health services, which include diabetic eye screening, vascular screening, nutritional advice, and consultations with diabetes specialists. So if you are listening to VOB right now and you have a diabetic related query or you need to make an appointment, you can call 243-3937. You can also follow us on Facebook or Instagram. The last 15 minutes you heard on VOB was brought to you with the compliments of the Barbados Diabetic Eye Screening Program in partnership with the Barbados Community Foundation and the Maria Holder Diabetes Center celebrating its 10th anniversary. Until next time,
drink more water. Did you know nearly 1 in 5 adults in Barbados have diabetes? Did you know diabetes is one of the leading causes of vision loss in the world? Regular eye screening can save your eyes. Contact the Barbados Diabetic Eye Screening Program today at 243-3937.